Hello, everyone. In this section of Chapter 1, we're going to be discussing anatomical and regional terms. I do have a list of regional terms I would like you to start memorizing. And the reason I want you to start working on it now is because they will basically follow through the rest of the semester. So when you hear the term, for instance, frontal is referring to the forehead or if we're thinking about like that forehead area. But there's also a bone that's called the frontal bone. You also have a lobe of the brain called the frontal lobe. So they kind of will start overlapping each other. So if you sort of understand them now, it'll make this a lot easier later on within the term. So we'll kind of start off on the anatomical positioning first, on the anterior view, and then we'll work our way to the posterior. So we will start superior and work our way inferior. First, we're going to discuss cephalic. And if you hear the term cephalic, if you break it into ceph or cephalo, it's referring to head. And if you hear encephalo, it's referring to the brain. So cephalic is thinking about like the head region. In the cephalic region, we'll see the frontal region, which again, we think about that forehead. Orbital is referring to the eye. Nasal is referring to the nose. Buccal is referring to the cheek. Oral is referring to the mouth. And then mental is referring to the chin. So these will all come in handy very soon, especially when we discuss bones, bony landmarks, and muscles. For instance, we'll talk about the frontalis, which is a muscle that we'll see that connects onto the frontal bone. Buccal will have a muscle called the buccinator, and it helps with actually like blowing, especially like if you think about like blowing air into a tire, or if you play an instrument where you have a specific embouchure, you would use that buccinator. And then like mental, again, thinking chin, we'll hear about the mentalis. So these will definitely be helpful. And again, just it's easier to learn them now. And then that way, again, it's a nice review when we start hitting bones and muscles and blood vessels as well. Working our way down into the neck, we have the cervical region. And so if you hear cervix, it's thinking neck. Even if you heard the term cervix, it's the neck of the uterus. Again, moving more inferior, we discussed the thoracic region. Thoracic region is referring to the chest cavity. And so, or you will hear it, we'll call it the thorax as well. So you may hear thorax or chest cavity, and that would be the thoracic region. And within the thoracic region, you'll have the sternal region, which is going to be referring to the sternum. Let me try that here in green. You would have the axillary region, which is going to be referring to the armpit region. And then you have the pectoral region, which we start thinking about sort of the chest and the pec area. And so within the pectoral region, we have like the pectoralis major and the pectoralis minor. If you're someone that works out, you actually utilize those muscles quite frequently. All right, we would be moving on to the abdominal region. So again, if you think about abdominal, we think about the abdomen. And within the abdominal region, we would find the umbilical region, which is the navel or the belly button. Again, moving more inferiorly, we think of the pelvic region. So we think about those pelvic bones or those hip bones. And sometimes the pelvic region will also kind of encase the inguinal or the groin region as well. So that would be this portion here. And then finally, we would get to the genital region or the pubic region. Now, looking from the extremity sort of idea, if we think about the upper limb, if you think about the shoulder, and if you start to feel around on your shoulders, you'll feel a little point. That point is called the acromion. So this is called the acromial area. Next, we will hit the deltoid region, which is kind of thinking about that upper arm motion area. And actually, we have a muscle here called the deltoid muscle. Delta is actually a triangular shape. And so when we look at the deltoid muscle, it's kind of like a upside down triangle when we see it. And then finally, if we're discussing the arm region and we're thinking upper arm, we're thinking about the brachial portion. So there's the brachial and then there's the antebrachial region. Brachial is referring to the arm. Antebrachial is referring to the forearm. So, and you will want to know these as well, because again, we will discuss, like, for instance, the brachial artery, brachial nerves, and then again, it will just help to make sense of this later on. So brachial is the upper arm, antebrachial is the forearm. And then when we think about the elbow, we're going to discuss what's called the antecubital region or the olecratal region. We call it the antecubital region on the anterior surface, so that front surface. So if you think about sort of like that pocket where your elbow would be, like your elbow's on the back side, the posterior side, but there's a little pocket, that's the antecubital region. Finally, moving down, and again, as we're moving distally. So proximal would be closer to the trunk, distal would be further away. If we look at the wrist region, we're discussing the carpal region. And then as we work our way towards the hand, we would call this the manus region. And then finally, if we hit the digits, we call these the digital region. We also call the same for the hands as we do for the feet. Or I should say for the fingers and toes. They would be the digital regions. All right, looking at the lower extremity here, we have the coxal region, which is the hips. And actually, when we discuss the hip bones, it's 3 fused bones put together, and we call it the os coxa. So coxal region, hip region. If you think about the thigh, and this works true for both anterior and posterior, we discussed this being the femoral or femoral region. So depending on sort of area, we may say femoral artery, or you may hear femoral artery. It's found within that thigh. And again, that will be the same for anterior and posterior. So they have the same naming front and back. For the anterior knee, so the front of your knee, we call it the patellar region because the bone here is the patella. Working on our way down the lower leg, we would discuss the crural region. And so this is where we would find like our tibia and our fibula. And then finally moving to the foot, we discuss the pedal. We'll have the tarsals for the ankles. Be careful, carpals are in the wrist. Tarsals are in the ankles. And then finally, again, for the toes, we talk about the digits or the digital region. All right, now working on our posterior surface, again, if you think of cephalo or cephalic, we're thinking of the head. On the back of the head, we have what's known as the occipital region. So remember, in the front, we had the frontal region. On the back, we have the occipital region. This will also make sense because, again, when we discuss bones, the bone on the back of your head in that posterior region is called the occipital bone. And when we think about the lobes of the brain, especially the cerebrum, you will find the occipital lobe. So it will work kind of together, if you will. The neck, again, is called the cervical region. That will not change. As we work our way down, now we're thinking about the back. So again, back, we're going to think of the dorsal region. If you're thinking about the shoulders, we're referring to the scapular region because the shoulder blades are actually referred to as the scapula. So when we discuss bones, you'll hear the term scapula. When we think about where our vertebrae are found, this is called the vertebral region. And we'll discuss that there are different types of vertebrae within. We have cervical, thoracic, and lumbar. If you get to sort of the loin or the lower back, we refer to it as the lumbar region. And then finally, this little triangle here is where your sacrum would be of your bones. So we refer to this as the sacral region. Imagine that it's sort of the region between your two butt cheeks, if you will, if you were sort of running your hand down your back. When we discuss the buttock region, we discuss it as the gluteal region. So hence why we call it the gluteus maximus and the gluteus minimus. We'll discuss those later on when we talk about muscles. All right, let's work our way down the leg, and then we'll go back to the upper limb. Again, for the actual lower leg, again, the thigh will keep the same name with the femoral region or femoral. The knee, though, is going to change. So the anterior knee we refer to as the patellar region, because again, the patella is the kneecap. On the back of the knee, we call this the popliteal region or the popliteal region. So we have two different names for the knee. Be very careful with this one. Patella is anterior, popliteal is posterior. And again, that kind of makes sense if you think of patella anterior, popliteal posterior, to kind of remember what happens there. On the anterior surface of the lower leg, we had the crural region. Now on the calf, we have the sural region. So crural in the front, sural in the back. And again, when we think of the foot, we refer to it as the pedal region. If you think of the heel of your foot, we call this the calcaneal region. And this will make more sense when we discuss, again, bones and ligaments. But you have a tendon here called the Achilles tendon that actually runs to your foot, to this heel. And it's actually called the calcaneal tendon, but it has the mimicry or we call it a common name, the Achilles tendon. And then finally, the bottom of your foot would be called the plantar region. So there are many regional terms to know. Again, I would start to memorize these now, start to feel comfortable with them, because it's just going to help you on later on in the semester, especially again, when we cover bones, muscles, and blood vessels. This will be very, very useful. All right, now we're going to discuss the idea of body planes and sections. So you'll hear the term section and you'll hear the term plane. Sections are actual cuts. Planes are imaginary lines. So for instance, if a surgeon was performing a cross section, they're actually doing cutting. Same thing if you were in a cadaver lab, we may cut into the leg or cut into the arm, and we will create a section. We're going to create a cut. However, in everyday life and healthcare, we're not able to just cut people up to be able to observe. We have to think about those imaginary lines and planes. So be careful with the difference between section and plane. But the planes and sections are actually the same. We're going to discuss 3 very common planes or sections, and they exist as right angles to one another. So I'm going to draw a not so cute picture of a heart. I'm going to draw 2 of them for right now. And what we're going to discuss is the idea of a sagittal section. So I have this heart down at the bottom, and if I was to cut it, and I made my line right here, I would be making a right and a left part. That is called the sagittal section. Make note, sagittal is spelled with 2 T's because this will, again, come up in the future when we go to write some of the naming. So a sagittal section or a sagittal plane would create a right and left half. This can be straight down the middle, or it could be off-centered. So if it is in the middle, we refer to it as either the median or the mid-sagittal section. So again, if I just put this square in the middle, that would be median or mid-sagittal. And if I just decided to cut into one portion where I had unequal right and left halves, that would be called parasagittal. So mid-sagittal, again, you're making equal right and left half. Parasagittal, again, they're not equal. So it could be like a little off, like maybe 60-40, or it could be a huge change, depending on where that cut is being made. We also have what is known as the frontal or coronal section. And this one's a little bit difficult to draw, but let me do my best. Imagine that I had that heart again, and I'm looking at it from a side view. I'm looking at it from a lateral view. And what I've done is I've made a cut that made a front, or known as anterior, and I made a posterior or back portion. So I cut to make a front and a back, an anterior or a posterior. And if you guys have ever seen the movie The Kingsman, this actually happens. The woman takes a sword and she slices the guy, and one half falls one way, one half falls the other. So it splits them into like a front and a back. If you haven't seen the movie, don't worry. For those of you that know it, send me a little email and we'll have a discussion about it in more detail. But basically imagine that I'm cutting you at the crown of your head, hence the coronal, and I'm making a anterior and posterior. We also use the term coronal or frontal. So again, if you want to think about it as a frontal section, it makes a front and a back. Or again, if you want to think of coronal, think of crown. That we're sort of like making a crown to make it anterior and posterior. And then finally, my last little picture is going to be of a horizontal or transverse section. And basically what's happening is I'm going horizontally, and I'm going to make a top and a bottom, or a superior and an inferior. Sometimes this is also called a cross section. So again, if a surgeon wanted to look, or again, in a cadaver lab, if we wanted to look at more muscles of the arm, we could just basically cut off the arm and create a cross section. And then we would be able to look down and see those specific muscles, nerves, and blood vessels. So there are 3 types you need to know. You need to know sagittal, frontal, or you can call it coronal, or transverse. Those will be the names that we will commonly use. Again, just make reference that you'll know that a cross section is the same as a transverse, and frontal is the same as coronal. So here's a really awesome picture to be able to see it from a sectional idea as well as from a plane view. So again, when we think of section, we actually think of truly cutting to make right and left, front and back. But in everyday occurrences, again, that doesn't take place. So we use planes, we use imaginary lines. So for the first picture that you can see in figure A, this is a mid-sagittal. So again, we're thinking equal right and left half. And that's what you can actually see from this MRI scan. So again, this is a way to be able to see that vertebral column. We can see the rectum and the intestines, because again, we're looking at a right or a left half. From figure B, again, we see a frontal or coronal plane. So we're making a front and a back, or an anterior and posterior. And here now in this MRI scan, we can see the heart, and we can see the lungs. We can also see some of those abdominal organs below. And then finally, last one is that transverse plane. And again, so we're making a superior and inferior, or a top and bottom. And we're able to look inward to see, like for instance, this is the vertebrae, this is the spinal cord. You can see a portion of the liver, see the spleen, because remember, this is posterior, this is the back, and this is anterior. That we're seeing here. So gives you an idea of what to expect for those body planes in those sections. All right, moving on, we're going to discuss the idea of body cavities. So there are cavities to sort of house specific organs and to provide a layer of protection, as well as not only are these cavities protection, there's also a double layer associated with them. So within there, they're going to have a secretion of fluid to help to prevent friction. But there's 2 internal body cavities, and then we're going to just basically split them from there. You have the dorsal and you have ventral. Remember, if we think of dorsal, we're referring to posterior, which is the back. And then we have ventral body cavities, which would be considering anterior or the front. And again, they're going to help to provide protection to the organs that lie within these body cavities, as well as secrete fluid to help to reduce any friction. So here's a great picture to, again, get that idea between dorsal and ventral. In yellow, you can see the dorsal body cavity. In red, we can see those ventral body cavities. So imagine, if you will, that you sort of have these two big picture ideas of cavities, and now we're going to split them and separate them even further. From the dorsal body cavities, we have the cranial cavity, which is going to help to house the brain. And we have the spinal or vertebral cavity to house the spinal cord. In the ventral cavities, we have a thoracic cavity, which again, if we think of thoracic, we are thinking about thorax as well as chest. So we'll find the heart, the lungs. We'll also find some other organs such as the esophagus and trachea found within this region. And then there is a split. So right here between the thoracic and the abdominal cavity, we find a muscle that is called the diaphragm. This muscle is extremely important when it comes to breathing, but again, it creates that separation between the body cavities. So this isn't one continuous unit. There's this thoracic, there's that change with the diaphragm, and then we move down into the abdominal cavity. And so the abdominal cavity, actually, there's really no split between the abdominal and pelvic cavity. So this is relatively referred to as the abdominal pelvic cavity. But to make life a little bit easier and to identify specific organs and structures, we will sometimes split it into the abdominal cavity and the pelvic cavity. And again, those are found in the ventral region. This is found in the dorsal region. And remember, dorsal refers to back, ventral refers to front. Ventral can also be called anterior, and dorsal can also be called posterior. All right, so thinking about the dorsal cavities again, we think of the cranial cavity and the spinal cavity. Some textbooks will also call it the vertebral cavity. So just as a reference, I may call it the spinal cavity or the vertebral cavity. The cranial cavity houses the brain, and if you think about it, there's a protection of your brain because of the skull. We have the spinal cavity or the vertebral cavity that's going to house the spinal cord, and again, there's a protection because of the vertebrae. When we move on to the ventral cavity, again, there's two subdivisions. We have the thoracic cavity. You get that diaphragm that makes a split, and then we have that abdominal pelvic cavity. In the thoracic cavity, we actually find more cavities within the thoracic cavity, but this is going to house your heart, your lungs, and some other organs such as the trachea, the thymus gland, the esophagus. And in the middle, the central region of this thoracic cavity, we find what's called the mediastinum or the mediastinum. Depending on terms, or depending on who says it, some people refer to it as the mediastinum, or you'll hear it called the mediastinum. So just as a reference, if you look online or hear other people have a reference, you may hear it both ways. But it's sort of the medial area. Again, this houses the heart, the trachea, and a couple other organs. And the thoracic cavity, again, is also protected by the rib cage as well. So we try to provide lots of proper protection to these vital organs. And again, we'll also find these cavities within to help to secrete fluid. Like I said, when we discuss the abdominal pelvic cavity, there's really no separation between the two. But this is going to be the below the diaphragm, so it's inferior. And in the superior abdominal cavity, we find most of the digestive organs. So we find the stomach, the liver, the pancreas, the spleen, and there is no bones that actually allow for protection in this area. So unfortunately, blunt force trauma to these areas can lead to organ damage and hemorrhaging. So we have to be careful. But there is protection because we have muscles within this area that are our trunk muscles that help to aid in a little bit of protection. When we start to think about the pelvic cavity, this is where we try to find the lower portions of the intestine, especially the large intestine like the rectum. We do find the bladder, we do find some reproductive organs, the internal reproductive organs as well. And there is a little bit of protection because, again, we do have our hip bones, we have that pelvic region. But again, there's no true structure that really separates the two. So they're called the abdominal pelvic cavity. And then when we think about the abdominal pelvic cavity, again, just sort of help us to orient ourselves and to understand where specific organs and structures are found, we break this cavity into subdivisions. So we can either discuss the quadrants or we can discuss regions. There are 4 quadrants, there are 9 regions. The first thing that we'll discuss are the quadrants. So again, quadrant is referring to 4. Imagine, if you will, that you have 4 kind of separate areas within this abdominal pelvic cavity. The first one that we'll see is the right upper quadrant. And when we go to name these guys, we say the either right or left first, and then we say upper or lower. And like I said, remember when we're looking at the screen, take a moment to actually draw yourself a little line, to tell yourself this is the right and this is the left, because it's not your right and your left, it's who you're observing. It's your patient that you're looking at, their right and their left. So to make sure that, again, we can continue to practice this and to help you, again, especially for a test when you already have anxiety and other things going on, just take that brief moment and make sure you kind of orient yourself to remember right versus left. It's not your right and left, it's the person you're observing. So in this region here, we have the right upper quadrant. And in the right upper quadrant, some of the organs that we're going to find are the liver, big chunk of the liver. We'll find this little green guy, that's the gallbladder. We'll find a little tiny portion of the stomach and part of the intestine, the small and the large. But majority, again, this is where the liver is going to be housed. You can actually feel it if you sort of move around in your right upper quadrant. If you kind of like start poking around, you'll feel that liver, this nice, big, huge, kind of muscular organ, if you will. On the left side, again, we have the left upper quadrant. We're going to be finding majority of the stomach. Behind the stomach, so posterior to the stomach, we would find the pancreas as well as the spleen. So we can't see it from this picture, but if we removed the stomach, behind there would sit the pancreas and the spleen. As well as, again, we can see a little bit of our intestine as well. And just to make mention of, this is the small intestine here. This is the large intestine here, just to kind of help to orient yourself. All right, moving down again, we'll go to the right lower quadrant, the RLQ, and we find the majority of our colon here, as well as our intestine, our small intestine and large intestine. Same thing on the left lower quadrant. What we're not able to see is we also do have kidneys and ureters running through this area as well. So the kidneys sort of sit in the back, if you will. They kind of are more in that right and left upper quadrant. And then you have the ureter that's running through the right and left lower quadrant. But again, it's kind of masked because they sit very posterior in comparison to those digestive organs. And then finally, right down below, we are going to find the urinary bladder. And again, we would also find some reproductive organs, internal reproductive organs as well. Okay, so not only do we have those 4 quadrants, we also have 9 regions. The regions seem very intimidating. They aren't, though. It just, actually, if you know the right, you know the left. The only ones that are a little bit tricky are the middle guys. So on the right and left upper regions, if you will, if we think about the more superior regions, we have the right and left hypochondriac region. Hypo meaning below, chondro is thinking cartilage. And so what's happening is this is below the costal cartilage of the ribs. So this is the right and left hypochondriac region. Moving lower, we have the right and left lumbar region. This has actually changed names, and this can also be different depending on textbooks. Sometimes this will be called the right and left lateral region. So we just have to be careful with textbook. Lumbar or lateral, that's what they're referring to, sort of that middle area. I like lumbar, and I prefer lumbar actually, because if you think about it kind of rolling in the back, this would be where you'd find that lower back region. And then finally, we have the right and the left iliac or inguinal region. Iliac is referring to the hip bone, the portion called the ilium. And then the inguinal is thinking of groin. That's how it gets its name. So if you know the right, you know the left when it comes to the sides, those lateral portions. And then in the middle, we have the epigastric. Epi is referring to above. Gastric is thinking of stomach. The umbilical region kind of serves its name. It's the umbilicus or the navel region. And then hypogastric also is known as the pubic region. I prefer pubic region, just as a heads up. So when you go to sort of practice the naming, I prefer pubic region because, again, this is where you'd find that pubic bone and you would find some of those reproductive organs. All right, so we do have some other body cavities as well. We are not going to be really making mention of them right now. I will not test you on it right now. They will come up later on. We do have some oral and digestive cavities. We have a nasal cavity. We have cavities for our eyes in the orbital region, as well as we actually have middle ear cavities going on as well. But like I said, that will be very brief for right now, and we will discuss those way more in detail later on when we start moving into the systemic part of the chapters, or the systems, if you will. All right, on a completely brand new topic, but a very important topic to discuss when it refers to anatomy and physiology, as we think about homeostatic balance or homeostasis. Homeostasis is the internal balance, the stability of your internal conditions. And so no matter what's going on in the external world, the internal world is going to stay stable. And it's a dynamic state of equilibrium or balance. Imagine, if you will, that you have like a teeter-totter and you wanted to make sure that you kept it directly in the middle. You want to make sure that there is this balance. There's no tipping up or tipping down. It stays at this balance. And our bodies spend so much time trying to keep this homeostatic balance. And it is necessary for normal body function, and it is essential to sustaining life. If you are not in homeostatic balance, this can cause a variety of disorders, diseases, and it can actually result in death. So we have to maintain a homeostatic balance, this internal stability. And so the main control systems are going to be the nervous system, as well as help with the endocrine system for hormonal changes and hormonal balance. And like I said, if you disturb this balance, it can result in disease. And if left untreated, it can result in death. So to maintain homeostatic balance, there are three components. There's a receptor that senses changes, but what they do is they send that information to the control center. The control center says, I either like this change or I do not like this change. And depending on its decision, that will be sent out to the effector. So the three components are the receptor, the control center, and the effector. As I said before, the receptor actually picks up the change. So there's a stimulus, it senses that there's a change, whether it's a change in temperature, a change in pain, a change in electrolyte concentration, and it sends that information to the control center. The control center determines the set point. It figures out the information. And again, it determines, yes, I like the route we're going, or no, I do not. We need to change this. And based upon its decision, that's carried out to the effector. And the effector is going to provide a means of response. It's going to take that information and it's going to run it down this, what we call efferent pathway. And so this is where we get to some feedback systems. The two major feedback systems that we'll discuss are positive and negative feedback. Negative feedback is usually the method of control. It is most homeostatic control mechanisms. And what happens here is there's a change. Again, that receptor sends that change to the control center. The control center says, I do not like the route we're going. So it shuts that off. It shuts off that stimulus. It reduces its intensity. And then it sends that information out to the effector. So for instance, your body temperature is running too high. It's like a thermostat. It's going to say, nope, that's wrong. Shut it off. And we're going to fix this. The same thing would happen if your body temperature was too low. Nope, don't like the route we're going. We don't want it to continue to get colder in here. We need to shut this off. This works for blood glucose levels. Your blood glucose levels are too high, shut it off. Your blood glucose levels are too low, shut it off. Electrolyte levels are out of whack. Your calcium levels are out of whack. No matter what, that control center says, shut off that stimulus. It does not like the route it's going, shut this off. That is negative feedback. And that's why most of our control mechanisms are controlled by negative feedback. So here's a nice little way to think about this teeter-totter, if you will. So remember that homeostatic balance is so essential. We want to make sure that we are staying in this very specific range and we're not going too high or too low. So the stimulus is what produces the change. Again, the receptor detects that change and sends that information to the control center. So the control center picks up this input, this information that was carried along this pathway. It either says, yes, I like it, no, I don't like it. And depending on what changes, it's going to be output that's sent to the effector, and the effector is going to make a response. Usually the effector is either a muscle or a gland that's going to carry out this response. And the whole goal is, again, to bring it back to this normal homeostatic level. We never want it to be too high. We never want it to be too low. So that's why negative feedback is so important. Now, we do have positive feedback. It's extremely rare in humans, but there are a couple examples that I'll talk about. The reason it's so rare is because this is actually going to push the stimulus farther away from normal. So again, this is very rare, and usually the reaction occurs really fast and is short-lived. Some examples that we talk about for the body is blood clotting. This is your, I got a paper cut blood clotting. Again, for that short period of time, your control center says, yes, we need to make more clotting factors. We need to clot this blood so you don't bleed out from a little paper cut. But again, we can't continue this because it will just shift that normal range. So again, it's going to occur fast and it's very short-lived. Same thing when it comes to uterine contractions. When mom is giving birth, it actually intensifies these uterine contractions. So you have more and more and more intensity, but the moment the baby is out, that stops. So again, it happens for a short period, it shifts the swing, but it's short-lived. Another thing that also happens as well is with milk letdown. So again, thinking about mom breastfeeding, it continues for a short period of time. So it increases or intensifies that original stimulus. And again, we're going to see these changes, these shifts and swings that are very short-lived. So there's not a lot of examples. In fact, those are the 3 examples I will give you for positive feedback. So when in doubt, if you aren't sure, go with negative feedback. More than likely, it's a negative feedback count. All right, guys, that's all I have for you today. I hope you are having a wonderful day, and I will catch you in the next video. Thanks, guys. Bye.